Thank you so much for joining me, Mallory. You are a certified speech and language pathologist, and you are in the same town as Dr. Temple Grandin, which is very exciting. Your clinical expertise includes coaching social communication skills, and I was wondering if you could tell parents out there, how do they spot if their child might be struggling with social communication?
Mm-hmm. So I think there's a couple of different ways to view this. Oftentimes, I think for parents, depending on if you identify as being neurotypical or neurodiverse, you may see things that you wish your child could do. I wish that they were talking to more new people, or I wish that they were more flexible in their problem solving, whatever that may be. But I think the way I try to structure social communication in my own brain, and this has shifted over time, and I try to dig deep into embracing neurodiversity the more experienced I grow as a professional. I believe it really needs to be client driven. So if your child or your loved one is coming to you and letting you know that there's a goal they have that they wish they could achieve. I wish I could make more friends. I wish that I wasn't so nervous going up and talking to a new group, or I'm interested in dating and I have no idea how to do it. So when you're hearing your loved one express hopes, goals, dreams, and they are open and motivated to building some tools to achieve those, I think that's a great time to find a speech language pathologist who works on social communication skills.
Okay, that's really good to know, because there's a clear difference between building functional social communication compared to the building blocks of just pairing sounds together to create words.
Right.
It's very different.
Yeah, they're completely different categories, because you can, as you know, many people I work with from an IQ standpoint and even from a language assessment standpoint would score higher on aptitude tests than I would myself. That doesn't mean that you're using those exact same language skills that prepare you to do exceedingly well, possibly in an academic setting, to perform exceedingly well in a social setting, because there is a very different. It just requires different skills: reading and meaning, nonverbal communication, tone of voice. All these different things have to come together.
Yeah, that makes sense. And for parents, if they could find some practical tips from you, or if you can give some practical tips for parents, what they can do to help a child if they feel their child might be struggling with some of the social communication skills that you were talking about. What would you say are some practical tips that you can provide them?
Yeah, so this is it's my area of passion, but also super duper tricky. So I think we are going to look back as speech therapists in 10 years, and there's going to be this big cringe moment where, and probably some very well-intentioned parents as well, who only wanted the best for their children and their clients. And they really dove in deep into what the social expectations were and how to coach those in that situation, inadvertently teaching that person on the spectrum how to mask full time and implying that masking is necessary. That you are less than and that you have to mask to be equal to. And now I think we're really wrapping our brains around, absolutely not. Neurodiversity is a thing and it's important, and we need to learn how to embrace our strengths. But also is build tools so that you can achieve whatever your goals are. And those may fall under social communication. So from a parenting standpoint, I always like to start conversations when your child or your teenager is facing a challenge. Just step one is figuring out what their perspective is and what tools they're already using to try to solve that, and see if there are any other strategies that seem somewhat obvious that you could try implementing. So an example would be a common thing teenagers land in my office is I try to join a group and people ignore me. They don't let me, they don't include me. I feel like I'm being left out. I feel like they don't like me, but I'm not sure why. And I don't know what it is that I'm doing wrong.
Yeah, that is common. We get that too.
So if I were a parent, I would start with, okay, so can you walk me through, if I were a fly on the wall, tell me what it looks like when you're trying to join this goal, starting with how do you pick which group you're going to go up to? How do you physically join the group? How do you know when it's your turn to talk? How do you decide what to talk about? How do you know which question to ask? And kind of break down the social steps within that and see if your child or your loved one is giving you confident answers. And you can do that exact same process for almost any social skill, right? Mm. An example would be sibling disputes. My sibling keeps touching all my toys and it's driving me crazy. Mm. And you can start by breaking down, well, how big of a problem does it feel like for you? What do you guess your siblings perceives that problem as? Tell me, what are your steps you're doing to solve that problem or prevent that problem from happening? And I'm viewing it always through a communication lens. Mm. So typically with younger kids, that's kind of a metacognitive thing. It's harder to really conceptualize what skills need to happen. But by the time you're a teenager, you really can. Back to that original, I'm trying to join groups, but people don't seem to be welcoming me. A very simple social thing that often happens. One of two things are very frequent, not problems, but just differences in trying to join a group that prevent success in my office. One is not physically joining the group. So there's so much social anxiety and so much worry. And if there's 3 people standing right here, walking this close, and assuming that they're going to register you're in the group, but they actually have no idea that you want to be part of that group. So a simple act of physically taking 3 more steps and waiting till they acknowledge you with, some sort of shift in body posture makes a world of difference. And if you try this 10 times, all of a sudden that just feeds into that social anxiety cycle. People don't want me, I'm not included, blah, blah. It's really, really easy to spiral up. And another common difference that I frequently hear is jumping in with a story. So I overhear someone talking a topic of great interest or something. I do have this really meaningful story to connect. But in general, studies replicate time and time again, joining in with a question is the best way to be part of the group. And then you can leave your story in. It's just when you jump in with a story, your peers are less likely to welcome you. So when I think about social communication, oftentimes it's just these little tweaks here and there. You still tell your story. You still present your wonderful, unique self. You're not changing who you are, but sometimes these tiny little shifts can just really promote success in social interactions. Yeah. And in turn, that grows confidence and willingness to try new things and, achieve social targets.
I think, that's brilliant. I was speaking to John Robinson, who's on the, who's autistic, and he's a great author and a lecturer. And he was telling me, teach children clear rules and boundaries and the way that they need to interact, because it becomes a habit to them. And, and also once they know, okay, if this doesn't work, I can try something different, they'll might feel less anxious because then they have a backup plan. Right. And also, if they are doing something quirky, this is what he said, which I really liked. He said, if they are doing something quirky, at least they did the norm for a while. So they greeted correctly, they opened the door, and then he said he kind of keeps it in the bank. It's like, it provides him a bit of leeway. So, and it's very similar to what you were saying, because you've got some rules and some different ways of trying it. And also you're giving quite a lot of validation to the person about how he's feeling or how she's feeling, and providing them with questions like, did you try this? Maybe try something else. And they need to kind of take that responsibility, I guess, to then try something else, or explain to you at least what they have tried and what didn't work.
And I love my favorite type of therapy, and I think I will one day no longer have a job because of this, is I love running groups that are client driven, because I think there's no better advice for how to shift social communication than from someone else on the spectrum who's faced a similar situation. Yeah. And so right now I'm running fewer groups because of the pandemic, but I frequently run several groups during the week where I love the sense of confidence it promotes when you get to teach a skill to someone else, and also that troubleshooting process of what works and what doesn't work. And I think long term, and maybe hopefully in the not so distant future, my job will be coached by someone on the spectrum who has been through the same thing and will be able to teach those skills to other people as well.
Yes, exactly. And we found the same thing with AIMS, is that we're collaborating with autistic adults because they've lived the experience, they have lived experience. So they know that um, something small that has changed exponentially is that we want our kids to express themselves through stimming. If that is the way that they need to regulate at that point in their lives, or perhaps forever, then it is something that they need to do. And that was not the case when I started doing my training in psychology and in autism related conditions. So that is something that we've evolved, and we are accepting more. And you also touched on the point that there is more of an acceptance and understanding of neurodiversity in general. So we're more accepting as as different nations of people thinking and acting differently, which is beautiful. So I think that the groups that you were talking about is going to help a lot of kids and adults to be advocates for themselves and the way that they want to do things, which is awesome. You also do a lot of other things. So you help children to improve articulation, phonology, apraxia, and stuttering or fluency training.
Right. So I can jump into that super quick. Yeah. This is, I think, when people hear speech or hear that I'm a speech language pathologist, they typically have an idea of what that entails in their head, right? Yeah. And most people either think of stuttering or pronouncing an R correctly, some form of articulation therapy. And I would say for me personally, the bulk of my caseload does contain people on the spectrum. Oftentimes, we're working on some form of social communication target and some sort of secondary thing as well, whether it is language organization or articulation or fluency, anything along those lines. But yes, it's a really wide range of targets that we're trained to support. And over time, I feel like I've just kind of narrowed what I work on. But depending on where you live and who your local speech language pathologist is, it's likely that they have different expertise as well.
Okay. Because a lot of parents would ask about a specific topic, but that is also something that you can cover. And your sessions follow home practice ideas. So to increase the rate of which skills are acquired, which I truly believe in. I believe in, if therapy is not generalized to the home environment, then it is definitely going to be quite location specific for a child. It's going to be very difficult for them to generalize from one environment to another. Do you have a few activities that you feel that parents can do at home to help them with language or communication?
I'll do like a few. I feel like it really is person by person, so individualized. But I can give some like broad things. I think for children like birth to 5, providing choices as often as possible is a language opportunity within the household. Yes. So, thinking a child as young as 12 months, you can hold up 2 different drink choices and their communication may just be eye gaze, like they look at the item that they would like, and then you have the chance to model, you'd like the milk. You'd like the milk, please. You may model sign language. You may hold it close to your mouth. If there's a motor planning concern like apraxia, which we know co-occurs oftentimes in kids with autism, just that nice, slow visual model is always helpful. So milk, and really, exaggerate it and show clearly what you're doing. So birth to 5 choices are great. Books are a wonderful activity for so many different targets. You're working on joint attention, you're working on language, you're working on sequential language, what happens first, in the middle, last. You can build vocabulary, ask questions, can you show me where this is, versus what is this, where you're labeling verbally on your own. I think birth to 5, our target is communication. And I say that because I think communication can look really differently. It may be a communication device. It may be eye gaze. It may be verbal speech. It may be prompting. But what we want is high repetition and lots of communication opportunities. And the other thing, like many, many parents know already, is kids are amazing. Communication. We often will judge what a kid is understanding based on their expressive communication. And with autism in particular, we know that's oftentimes not true. And so we want to provide these communication opportunities, but also make sure we're not always modeling the type of language that we're hearing. Provide some more rich language models. Try mixing up books and just kind of testing what your kid may show interest in. Also, birth to 5, it's extremely important that language is worked on through motivating activities.
Yes, definitely. Yeah.
And you will quickly burn out a 3-year-old if you are trying to work on language during a less preferred activity.
Yes.
A battle every day. And then your target is to label articles of clothing. That simply is just not a good learning opportunity. If snacks are their favorite thing, food is going to be a great starting point, like whatever, or if gross motor is your favorite thing, that's what you want to use as a starting point.
I love that because I remember my years of training, and we always had to end with the correct trial, and I never really believed in that because I was like, well, if I can see the child doesn't want to and he's not going to request for this verbally, then I would rather go to a different mode of communication because I want him to be successful or her to be successful. I don't want my percentage to be successful. I don't care.
Exactly. That's where every now and then, and it's just different models, right? And I'm sure there are different speech therapists even who hold different opinions on this particular topic, but you want to grow interest and motivation to communicate. And from there, the world is, there's no endpoint, right? You can shape and shift. Once you start using one skill, it's the building block for a new skill. And I think finding opportunities to really celebrate those small victories and working with speech therapists who inform you really what all those little tiny milestones are so that you notice them. Because if your target is my child's not yet producing verbal speech and I want him to be, telling me his wants and needs, it may take time to build those skills, and those skills may ultimately look slightly different than what you thought they were going to look like. But if you know all of the tiny milestones that your child has mastered along the way, it's much easier on the parent side to maintain your motivation to keep working toward those things.
That's an important point. Many parents, because they've been on this journey for quite some time, they tend to forget all the different milestones that their kids have reached just because there are so many different things that we're working on. And we often ask parents to take videos of their kids, like maybe once every 2 months or something, and then just reassess where they came from. And that to me is, it's really nice to see as well. On that topic, I wanted to ask you, Mallory, in your practice, would you ask the parents to sit in some of your sessions? What would you say is the best there to generalize to the home environment?
So I too believe generalization is so important. I also know how deeply sensitive and vulnerable certain social communication targets can be. And so it really, for me, depends on client willingness. I love having parents sit in the room personally. If the person wants the parent in the room, I'm happy because I think I learn the quickest after I watch someone else model a target. That's my personal learning style. And so I love to be able to model targets for parents as well and help just kind of show how you can work on things in different settings, and it doesn't always have to be structured. That being said, I do think for me, I would say starting around age 9, 10, if a client expresses that it's embarrassing or they don't want their parent in the office, I respect that. I don't have the parent in. And then we'll have like a debriefing session one-on-one with me and the parent at the end to talk about what they can reinforce during the week, respecting that child's privacy or the teenager's privacy. I was trained doing a lot of early intervention, and that model is pure generalization, right? 45 minutes of parent coaching, and then it's generalized during the week. And so I do try to come up with ways that we can replicate a similar model. How can you incorporate daily practice into your home routines to promote growth with that target? And I find that families who are able to do that successfully, and I provide them with a reasonable plan to do that, often like 50% of the time it's my own fault. I recommend something that's not able to be carried out. You do see the biggest growth. So it's hugely important. And I think it's, depending on the person, done differently. But regardless of who it is, even I work with adults as well in my practice. And oftentimes when I'm working with adults, we'll create the plan and some sort of like progress monitoring system at home. And then they complete that throughout the week, make notes about what's working, what's not working. And then we use that as our driving point for the next therapy session.
Mm. Yeah, that's good. The accountability factor there too. We've been jumping with ages, and I'm sorry, it was my fault because
Yes,
I went to the young ones.
No,
And then
yeah.
again, with the generalization, and I really respect that, because you should respect the confidentiality always. And even with the little ones, sometimes we just kind of assume that it's fine to send recordings or whatever, but that's good, because when we've got the autistic adults now saying, look, you need to not show the meltdowns on your social media, like that's not nice for us. And it's so good because we're learning so much. What I think is really important is that modeling factor that you mentioned, is to kind of show how you communicate with your teens and the adolescents and the adults that you work with, and you provide them that space to be whoever they want to be. And then maybe even doing some parenting coaching on the side to just kind of let them know this. I think that you should focus more on this topic, or leave that topic alone. I'll focus on it. Those kind of things I think is quite important that you obviously do with the parents.
Right. If you're 18 or younger, there's a parent component in every session, whether it's with the client in the room or without, or some sort of touching base later in the week. But in adults, I respect whatever they prefer.
So I work with adults. We work with young kids, but I specialize working with adults. And one of my clients, we would have 3 sessions, and our 4th session is always with his parents. And he actually requested for it. So I did ask him, is it okay? And he said, yeah, every month we can do that. And it's a really good scenario, because it's quite different when his parents are there. I see the other side.
Right. Oh, okay. That's genius. I'm going to make note of that for my own practice. It's really interesting. From the parenting side, you spend your child's childhood working so hard, right? Out of love and helping grow skills. And sometimes there's this window starting in the teenage years where you're trying to like relinquish some control and have your child or teenager become more independent with whatever skill. An example that I would use is maybe your teenager is really interested in dating. And that's not mom's job, But even in that setting, because kids have been to so many therapies with their parents by the time they're in their teen years, if I have parents in the room, I'll ask a question, and the teenager may wait for their parent to answer at first with regard to dating. And it's like, your parents don't know any of this stuff. This is so unique to you and what you're interested in. So for me, with the communication target, sometimes I'll see a shift in dynamic where teenagers in particular want their parents to respond, because then they can avoid talking about whatever the challenge is. Yeah. And it just doesn't flow quite the same.
Yeah, it's a tricky subject. I think it's so different to work with each kind of group. Like we get our youngsters, and for me it's always quite easy to do that kind of intervention with the young children. And then when they grow up, they're completely different. And then when they're adults, again, you have to take on a different approach. That's why we need to be also quite flexible. And also parents need, they do understand, because they went through all these different phases, but they'll understand that their kids are going to change. Our youngsters that are going for quite a lot of therapy might need less. Hopefully that's the case, where they need less therapy when they're a bit older. So that's. And you wrote a book with Rachel, your friend.
Yes. Yeah, we wrote a couple of different books together, but we're both really passionate about the experience, or I'm trying to think how to phrase this best. So we've written a couple of books. One is the parenting experience, kind of from diagnosis to, preparing your kid for adulthood, of raising a child on the spectrum. And then we also wrote more of an adolescent to adulthood book targeting both person on the spectrum's experience versus parent on the spectrum experience with regard to certain topics. That's like inclusion or academic supports. Were they needed or were they not? Were they appropriate? And that book was really provided me with a lot of new insight into sometimes good intentions may be very different than what your child is experiencing. And really, especially in situations where a parent is, I keep using neurotypical, neurodiverse. That's probably not the best way to say that, but identifies as neurotypical and the child is neurodiverse. Sometimes you can have very, very different perspectives on what is like, quote unquote, best in each life milestone.
That's so important. I have a friend and she's autistic. She's a medical doctor and she actually walked away from that and she's now a translator for a medical journal where she translates from German to English and vice versa. And she's learning Japanese on the side. So definitely neurodivergent, yes. But we would often have discussions and I would see it a certain way and she would see it a completely different way. And it's the same scenario, and we find it fascinating. So we learn from each other all the time. I wouldn't say that I'm very typical, but I definitely think different than how she thinks about certain situations. And we actually wanted to start a podcast on that specific topic because if you just think about dating, I might have a certain thought about a fight that I had with my partner who's on the spectrum. So, and this is a perfect example. Like, I wouldn't trust the intention if he said something, because in the past experiences, the data that I'm gathering is that people lie. But now I'm dating somebody that is autistic and he is not lying. So you have to kind of like keep that in consideration and then change your way of thinking again. So everything is a learning process, and it's not just, we don't just teach, we have to learn to be evolving professionals.
Right. Both of our books also kind of center around the notion of like finding your community and in your tribe and relying on each other to, work through, celebrate the highs and kind of work through the lows together as well. And it was just a great learning opportunity for me. It's how I initially, Rachel's kind of known as the local autism expert in our area. And I just by happenstance had crossed paths with her. And she's so ambitious. She'd invited me like after the second time she met, she's like, I have an idea for a book. Do you want to do it?
That's awesome. I read about the first book. Somebody asked you, one of your clients asked you, are you writing a book? And then 3 weeks later, you guys started writing a book.
Yeah, I know it truly happened that way.
Awesome.
I try to say yes to opportunities whenever I can.
Yes, that's great. And that's a good attitude to model, because that's what we want to show our clients too. I'm going to leave a link to your 2 books in the comment section below, and I will also just add your contact details so that if parents want to make contact, because I know you do telehealth services and you can possibly help them virtually if they don't live next to Dr. Temple Grandin or yourself, so they can get in contact with you. But it was really lovely to speak with you, Mallory. And I don't know if you had any other suggestions or.
I feel like I was profoundly vague, but it's because I feel so strongly that it really is there's no one course of treatment. And I think on the parenting side, if you feel like you've hit an obstacle or a roadblock, something's not working, explore different paths, because there are so many different ways to grow communication skills, social communication skills, kind of similar to the point that you mentioned earlier, that your kind of therapist profile may shift over time. I think it holds true for speech therapists too. No, I said I used to do early intervention. I'm currently not, because my practice focuses more on adolescence and adulthood. Okay. I think there are speech therapists who are best suited for different ages. And so maybe the speech therapist who helped your child access their communication skills and was life-changing for your family, who was absolutely perfect from, ages 4 to 8, may no longer be the best therapist for those early teen years. So just, I would keep openly assessing what feels like a good fit. Does it feel like we're making progress? Do I know what my targets are? Does it make sense? Can I implement it? And just keep moving forward. I am so passionate about this field. I think that is one of the more meaningful things I can do with my life. And I think that if you're a parent and you have questions about whether or not it could be a good fit, the fact that that question is there, it's probably worth calling a local speech therapist just to kind of have that conversation and see if there's any area they can support your child in.
Yeah, that's awesome. And also, I think for parents, it's important to know that speech therapy doesn't necessarily need to continue for years and years on end. They can do it, and if financially it's not feasible for them to continue, they can always do it for a limited amount of time and ask the speech therapist what can they do at home. And that's so valuable what you said about speech therapist for early intervention might be great for a certain amount of years, and then you might need to go over to social communication groups or some other extramural activities to help your child to integrate into social events.
For sure.